All right, guys. This is the last part of it, the treatment process. And at this stage, we've given the first trial, the second trial, the third trial, and the anxiety level of Mr. Caesar was able to reduce from 10 to 5, which is very an improving. It's a good improvement in terms of exposing and reducing the obsession and compulsion that he's gonna be experiencing in OCD. So this is the last stage. Let's see how Mr. Caesar is looking based on our techniques that we've used earlier. Thank you. How you doing?
I'm good.
How's it going?
Not bad.
And how you feeling today?
I'm pretty well.
Yeah. Before we try to go on with today's therapy, I wanna ask you about your feeling of the last activities that we did, about you touching things, you having a pre-assumptions that they are not clean,
Yes.
and increasing your anxiety level. And did you try doing anything or touching stuff at home or at work or any other thing? How are you feeling now?
Or I feel somehow comfortable touching things even before cleaning them
Okay.
compared to before I came for the therapy. But I'm so sure that after our last session, things are not getting that bad.
Okay.
Yeah.
Wow. Great. That's
The
interesting.
obsession of cleaning and making sure that I clean before touching anything is reducing drastically.
Wow. That's great. That's
And
great.
I can tell you it's a great improvement on my end. Yes.
Wow. I'm really happy to hear that. But today we're going to conclude it and see your and experience your improvement more, and try to reduce your anxiety level more by doing it again. So can you go on? You can touch the table now. Yeah. That's good.
I think I can do it.
Yeah. You can. You can. You can.
The obsession on making sure that everything is clean before touching is gone. And thank you so much for the help.
Yeah, no, that's really cool. That's
Though
really
it wasn't
cool.
easy
Initially. Yeah. I can understand. So how would you rate your anxiety level right now?
I think it has reduced to. Do you have a number like 0?
No, it's impossible. Everyone has it, but it can reduce to that extent. It can just be moderate, not really affecting your daily life, your activities. So that's just it. But from what you said, I can see you're more confident that it has drastically reduced.
Yes.
Yeah. All right. Thank you.
Thank you so much.
You can remove your hand right now.
I can touch it. More and more.
That's great now. But after you touching it without cleaning it, how do you feel? Do you feel like you have been infected or something?
I feel
or
like
it has reduced.
Well, before I could feel that I'm exposing myself into germs, maybe because of my previous what I went through, and but I can say it's okay.
Yeah, that's it. So that's just how to live with it. You get so you try as much as possible to face the unpleasant situation, which is touching things. You get touch it and you see nothing will happen. You get because on normal basis you get yourself cleaned, you get everywhere clean, but getting it clean more frequently to the extent that it affects you, that leads to that results to the problem. Is that fine?
Yeah.
Do you have any other question for me?
Yes, I have another question for you.
Okay, can go ahead.
So does it mean that our action determine what we think about?
Yeah, in most cases, what you think about, what your thought is, determines what you do.
What you do.
Do you get? It's because you are having a thought of when you touch things, you're gonna have germs, you're gonna have viruses, you're gonna have diseases. That's why you keep avoiding yourself to touch things, like having you touch the table. Do you get? But in a normal circumstance, there are viruses everywhere. But you bath daily, you clean up your things, you clean up your utilities. That's enough already. Sanitize everything. But now you've already changed your thoughts about how the germs and viruses and disease works. So now you can freely touch anything. Do you get? Without having the thought that okay, you might be infected. So that is exactly your thought determines your action, and that's why using the exposure and this and response prevention technique makes it much more easier for us to reduce your symptoms of obsessive compulsive disorder.
Thank you so much.
Is that fine?
That's very okay.
All right.
Thank you so much.
All right. So I'll keep seeing you some other times.
Thank you.
All right. Have a nice one.
Thank you so much.
All right, guys. That's like a demo of how you're gonna when you are finding symptoms of OCD. That's one of the major techniques used by CBT. As CBT, which is the expose, response and unresponse prevention, exposing the client to or exposing the child or the adult to the things that are making them feel obsessive and resulting to compulsion. So this reduces the level of the anxiety they have and automatically also reduce the OCD symptoms. All right, thanks for watching. Do have a nice time. Bye.